Cardiomyopathies is a rare and life-threatening disease in pediatric population. Children with cardiomyopathy end up having cardiac transplant, long-term hospitalization, and sometimes death. One of the toughest things for the clinician is to predict how the patient history will be, even though medications and intervention is performed. So what we're doing in the MD-Paedigree study is to try and support the clinician through cardiac modeling in his medical decisions, trying to understand how the heart is behaving in this disease and how the disease will evolve and the patient will end up in his follow-up. The aim of the cardiomyopathy study is to provide patient-specific models that will help a clinician understand pathophysiology and history of the cardiomyopathy disease in pediatric patients. What we want is to figure out beforehand the history of the patient, the follow-up of the patient, identify which patients are at higher risk of developing life-threatening conditions, which patients will need transplant, and what will be the timing for the transplant and for hospitalization. With the development of patient-specific models, we will also be able to identify the reaction or the effect of medications on a specific patient. This will help the clinician to target and give to the single patient the best possible medication and the more efficient treatment he deserves. The Ospedale Pediatrico Bambin Gesù had a very active role in this project. We conceived and designed part of the study, and we are actively recruiting patients to increase the number of observations and strengthen the model. At current, we have enrolled over 60 patients with cardiomyopathies, some of which have already undergone cardiac transplant.
Our aim in modeling cardiomyopathies is to create patient-specific models of the entire heart. These models include not only the anatomy of the patient, but also its function, the electrophysiology, the biomechanics, and the hemodynamics, which is the blood flow. All these models are personalized from different data that we receive from the clinicians, from imaging, from clinical measurements, and the main challenge is here to get a model which is able to reproduce the clinical findings and potentially in future to predict changes based, for example, on a different heart rate, on a different blood pressure. If we manage to achieve this goal, we could use these computational models to predict and to the best therapy and to assist the clinician in selecting better therapy for his patients. Our role at Siemens is to develop these models along the entire pipeline. We extract the anatomy, we develop the computational models for electrophysiology, for biomechanics, and for hemodynamics, and we work on the personalization on the patient-specific data.